Hi, I'm Corey with Ried Physical Therapy, and I'm here with some information about shoulder bursitis today. First off, what is a bursa? A bursa is a fluid-filled sac. We have them all over our body where we have moving parts that could be rubbing on each other. The fluid of the bursa allows for a frictionless surface for these moving parts to slide on. So things like muscles, tendons, ligaments tend to need something in between them to make sure that they're not rubbing up against bone and breaking down. A lot of times these bursts can become inflamed. In our shoulder, that bursitis can be caused by overuse or by trauma. Something like people who throw a lot, people who do a lot of overhead lifting, or people who do any one motion repetitively over and over again can fire up that bursa and cause it to inflame and swell up. And something as simple as bumping into a wall can cause a bursitis as well, or something more complex and more traumatic, things like car accidents or big time collisions in sports and that kind of thing can cause these things to inflame. Either way, be it chronic, like an overuse injury, or acute, like a trauma, these things can be painful. It can cause a lot of dysfunction in a joint. In the shoulder, that can mean difficulty lifting your arm over your head, difficulty completing little tasks, difficulty with lifting objects, difficulty maintaining positions even at the shoulder. And that can over time lead to movement issues and lead to different kind of changes in habits that cause dysfunction in the shoulder. So when we're having these issues and we're having that soreness in the shoulder that's related to a bursa, a lot of times the best idea to get things moving, get things started is physical therapy. A physical therapist can take a look at all the movements that are going on at the shoulder, identify the cause of that bursitis, and help to start improve the strength around the joint, improve the mobility of the joint, and help to support the other muscles in that around a joint and other joints that can be contributing to emotion so that we can take some stress off of that bursa and allow it the room to heal up that it needs so you can fully return to the kind of functional things that you want to do.